What if both of the heart's major arteries came out of the same ventricle? Normally, the aorta comes from the left ventricle, while the pulmonary artery comes from the right ventricle. But in a rare congenital heart defect called double outlet right ventricle, or DORV, both major arteries arise primarily from the right ventricle. So how does blood reach the lungs and the rest of the body? And why can DORV affect people differently? Let's find out. Welcome back to Heart Lifelines. Today, we're exploring double outlet right ventricle, a congenital heart defect that develops before birth. We'll explain what DORV is, how it changes normal blood flow, its symptoms, how doctors diagnose it, and the treatments that can help. What is DORV? First, let's look at how a normal heart works. The right ventricle normally pumps oxygen-poor blood toward the lungs through the pulmonary artery. The left ventricle pumps oxygen-rich blood through the aorta to the rest of the body. These two pathways help keep oxygen-poor and oxygen-rich blood moving in the correct directions. With DORV, both the aorta and pulmonary artery arise primarily from the right ventricle. This changes the normal connection between the heart's chambers and its major blood vessels. DORV is not exactly the same in every person. The position of the arteries and the presence and location of other heart defects can vary. One of the most important associated defects is a ventricular septal defect, or VSD, a hole between the two lower chambers of the heart. This opening can provide a pathway for blood from the left ventricle to reach the aorta or pulmonary artery. How does DORV affect blood flow? So what happens to blood flow? It depends on the specific anatomy. Because both major arteries arise from the right ventricle, the blood leaving the left ventricle may need to travel through a VSD to reach one of the arteries. The location of that VSD can make a major difference. In some forms of DORV, the VSD is positioned closer to the aorta. In other forms, it may be closer to the pulmonary artery. There can also be narrowing of the pathway leading to the lungs. Because of these differences, DORV can sometimes cause too little blood flow to the lungs, too much blood flow to the lungs, or difficulty getting oxygen-rich blood efficiently to the body. That's why two people with DORV can have very different symptoms and treatment plans. Symptoms often depend on the exact heart anatomy and how much the circulation is affected. Some babies may develop symptoms shortly after birth. Possible signs include bluish or grayish skin, caused by low oxygen levels, rapid or difficult breathing, difficulty feeding, unusual tiredness, fast heartbeat, poor weight gain. In some cases, symptoms can be less obvious, especially when blood flow is not severely affected. DORV can also occur alongside other congenital heart defects, which can contribute to the symptoms. How is DORV diagnosed? Doctors can often diagnose DORV using an echocardiogram. An echocardiogram uses sound waves to create moving images of the heart. It can help doctors see where the aorta and pulmonary artery originate, examine the ventricles, and identify a VSD or other structural abnormalities. DORV can sometimes be detected before birth during a fetal echocardiogram. After birth, doctors may also use tests such as an ECG, chest X-ray, cardiac MRI, or CT scan, depending on the situation. These tests help create a detailed picture of the heart's unique anatomy. How is DORV treated? Treatment depends heavily on the specific type of DORV. Because the anatomy can vary, there isn't one single operation that works for everyone. Some babies may need medications or other supportive treatment soon after birth. Ultimately, many children with significant DORV require surgical repair. The goal is to create a circulation that allows oxygen-poor blood to reach the lungs and oxygen-rich blood to reach the body as efficiently as possible. Depending on the anatomy, surgeons may close or redirect the VSD, create a pathway between the left ventricle and the aorta, or address narrowing or other associated defects. Some children may need more than one procedure as they grow. That's why lifelong follow-up with a congenital heart specialist is important. Living with DORV. DORV is a complex congenital heart defect, but advances in pediatric cardiology and heart surgery have greatly improved treatment options. The long-term outlook depends on the specific anatomy, associated heart defects, treatments received, and how the heart functions over time. Regular cardiology care helps doctors monitor heart function and identify potential problems early. DORV shows us just how important the connections between the heart's chambers and blood vessels are. Even a small change during development can completely change the path blood takes through the heart. Thank you for watching Heart Lifelines. We'll see you in the next video.